Case study: Understanding hypothyroidism due to thyroid failure in Hashimoto's thyroiditis, autoimmune thyroiditis. Answers. Patient presentation. Patient, 45-year-old male. Chief complaint: fatigue, unexplained weight gain, and sensitivity to cold. Medical history: family history of autoimmune diseases, especially Hashimoto's thyroiditis. Exam findings: paleness, dry skin, puffiness around the face, and elevated BMI. Lab results: TSH, 12 μl, high. Free T4 to 0.6 nanograms DL, low. Positive anti-TPO antibodies. Key statistics and insights on Hashimoto's thyroiditis. High prevalence. Hashimoto's thyroiditis is the most common cause of hypothyroidism in the U.S., affecting approximately 5 out of 100 people. Autoimmune basis. Autoimmune thyroiditis, specifically Hashimoto's thyroiditis, targets the thyroid gland, leading to its destruction. Hypothyroidism due to thyroid failure. Autoimmune thyroiditis often culminates in thyroid failure, leading to hypothyroidism as seen in this case. Risk factors: family history of autoimmune diseases, such as Hashimoto's thyroiditis, increases the risk of developing hypothyroidism due to thyroid failure. Diagnosis: elevated TSH levels, low free T4, and presence of anti-TPO antibodies are key indicators for diagnosis. Treatment: thyroid hormone replacement therapy is the gold standard for treating hypothyroidism due to thyroid failure. Regular monitoring. Periodic TSH and free T4 level checks are essential to monitor treatment effectiveness. Impact on quality of life. Hypothyroidism can significantly impact the quality of life if left untreated, making early detection vital. Autoimmune thyroiditis. Answers. This case provides insights into the multifaceted aspects of managing hypothyroidism due to thyroid failure, particularly in Hashimoto's thyroiditis. Summary. This case study aims to provide autoimmune thyroiditis answers by focusing on hypothyroidism due to thyroid failure in the context of Hashimoto's thyroiditis. The autoimmune destruction of the thyroid gland is a principal contributor to hypothyroidism, confirmed through elevated TSH, low free T4, and presence of anti-TPO antibodies. Treatment with thyroid hormone replacement therapy showed promising results. For more information, for a comprehensive understanding of Hashimoto's thyroiditis and hypothyroidism due to thyroid failure, consult medical databases like PubMed, clinical guidelines, and specialized endocrinology textbooks.